We retrospectively reviewed hospitalization data from the national inpatient sample for all hospitalizations in the database from 2014 to 2017, where a patient underwent either an open or surgical mitral valve repair, and compared it with transcatheter mitral valve repair. My name is Bradley Kay. I'm a second-year cardiology fellow at Yale New Haven Hospital in New Haven, Connecticut, and I'm here to discuss our recent study titled Comparison of Transcatheter versus Open Mitral Valve Repair amongst patients with mitral regurgitation, which will appear in Mayo Clinic Proceedings in the June 2021 issue. Special thanks to my co-first author, Fouad Kouari, and Dr. Nihar Desai for all of their support with writing this paper and the statistical analyses. We analyzed several patient factors, including race, socioeconomic factors, and geographic regions, as well as hospitalization-specific factors, including length of stay, mortality, and discharge disposition. We excluded hospitalizations where the patient for the hospitalization had mitral stenosis or also underwent concurrent coronary artery bypass grafting. We found that the rates of transcatheter procedures for mitral valve repair increased significantly over the time frame of the study compared with surgical valve repair, which did not increase to as significant a rate. We also found that hospital length of stay decreased for both procedures over the time frame. It's important to note that with a retrospective study of this kind, direct comparison between the two groups can be challenging, if not entirely impossible. There's an inherent selection bias in the procedures that these patients undergo, where older and sicker patients are generally going to be selected for the less invasive transcatheter procedures, whereas younger and healthier patients are going to be selected more often for the surgical valve, which limits direct comparison of these two procedures. A patient may ask, why couldn't they just simply opt for the less invasive procedure, which is a fair question, as they're more often selected for the open heart surgery, which more people would not electively choose to have an open heart surgery. The durability of open heart surgeries has been much more well established, and the indications for open heart surgery are much broader than those for the transcatheter procedures, which is important to bear in mind when selecting the type of procedure. We anticipate in the coming years that the volume of transcatheter mitral valve repair will increase even further, given the results of the recent COAPT trial, which has further expanded the indications for transcatheter mitral valve repair, not just including now degenerative mitral valve disease, but also functional mitral valve disease. These indications were also reflected in the 2020 valve guideline updates, which came out in December of 2020. This study is significant in that it shows the growing volume of mitral valve repair via transcatheter approach, and more centers seem to be doing the procedures, opening up more patients to receive them for whom they're indicated. Future studies could look more in depth at transcatheter mitral valve repair in the era of the COAPT trial from 2018 and beyond, once that data becomes available. We hope that you find our paper informative and helpful in pushing forward more research into the study of this very useful and life-saving procedure.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.